Hello, and welcome to Mental Health Corner. Today is World Mental Health Day, and every year a new topic is chosen to discuss. This year, it is living with schizophrenia. Schizophrenia is a mental disorder often characterized by abnormal social behavior and failure to recognize what is real. It produces a gradual decline in functioning, so it rarely occurs unexpectedly. There are usually early warning signs, which can last 1 to 3 years, which provide the perfect place to intervene. If you think you or a loved one might have schizophrenia, please talk to a family doctor. They'll probably interview you, your family, and friends to come to a conclusion, but ultimately it is a mental health professional that will be able to make the diagnosis, as they are the ones that have more experience and knowledge about this mental disorder. A diagnosis is made when the following exist. Schizophrenia symptoms have been present for at least 6 months. The patient is considerably impaired by these symptoms. For example, has serious difficulty working or with social relationships compared to the period before the symptoms began. Symptoms can't be explained by another diagnosis, such as drug use or another mental illness. Keep in mind that schizophrenia patients are afraid of their symptoms, which causes them to hide the telltale signs to make a diagnosis possible. Reassure your loved one that the only way for them to get help is not to hide their symptoms, but to show them. People with schizophrenia have at least some of the main symptoms. For psychiatrists to make a confident schizophrenia diagnosis, some of these symptoms must be present. Hallucinations. This means hearing voices or other sounds that aren't there or seeing things that don't exist. Delusions, such as unshakable beliefs that aren't true. Disorganized speech and behavior. Disorganized speech and behavior, such as talking and acting strangely. A lack of motivation and emotional expression. Lack of energy and poor grooming habits. Specific types of psychotic symptoms, called first-rank symptoms, when present, make a schizophrenia diagnosis more likely. Hearing your own thoughts spoken aloud. Feeling that thoughts are being inserted into your mind or removed from it by an outside force. Feeling like other people can read your mind. Feeling that an outside force is making you feel something, want something, or act in a certain way. Hearing voices discuss you or argue about you. Hearing voices narrate your actions as you perform them. The mainstay treatment of schizophrenia is antipsychotic medication, which primarily suppresses dopamine receptor activity. Counseling, job training, and social rehabilitation are also important in treatment. In these cases, where there is risk to self or others, involuntary hospitalization may be necessary, although hospital stays are now shorter and less frequent than they used to be. Please don't judge others based on a mental disorder. Having a mental illness is something that they can't control. It is not something that they chose to deal with. They are trying to deal with this the best way that they can. I hope that I have done a good job expressing what schizophrenia is and how to get treatment, and I also hope to end the stigma surrounding around mental illness. Take one day at a time, take the necessary treatment options, and remember, stay strong. Not in the mood. I don't want to do this right now, but I have to get it done. I'm starting to tear up. I have to chill. I'm freaking out right now. I'm not in a good mood. Okay. This is just the real life struggle of someone with depression and anxiety. But today, it's not my anxiety that's bothering me. Today is my depression. Okay. I'm gonna chill right now while I'm recording. That's right. I'm gonna text. The mainstay treatment of schizophrenia is psychotic medication, antipsychotic. Yeah, no. I'm getting itchy right now because I'm stressing out. Because of my anxiety. Because my neurodermatitis. I diagnosed... If you or a loved one have... If you... This whole thing is just going to be a thing of outtakes.